Hi, welcome back to the Cycling Clinic. I'm Yannick Gabe. I'm an orthopedic surgeon and a cyclist, and today I want to talk about how to assess a rider who's just had a crash on the bike. As much as we all love cycling, I think it would be irresponsible to ignore the risks involved in cycling. My goal with this video is to provide you some tips and principles so that when a crash occurs, you can think clearly, calmly, and effectively, and avoid any unnecessary damage. As an orthopedic surgeon, we spend quite a bit of time in the emergency room dealing with trauma of all kinds. A key principle when evaluating a trauma patient is to first assess the patient as a whole before you focus specifically on their injuries. The same principle applies to cycling. After a crash, your first job is to not only assess the scene and the safety of the scene, but also get a global assessment of the injured rider and not just focus specifically on the body parts that are hurting them. Speaking up and alerting riders and traffic to the presence of a downed rider is very important to maximize the safety of the scene. A key principle is we want to protect the downed rider from any secondary impact, which unfortunately is very common in road cycling crashes. By alerting others to the presence of a crash, you can create a much safer scene for you to then assess the downed rider. Performing a calm survey of the patient is as easy as asking a few questions to assess their orientation level and to whether you're suspicious of a serious injury affecting the head or the neck. When assessing a downed rider, the first thing you want to do is to help them stay calm and not ask them to get up right away. As you can imagine, there's a ton of adrenaline flowing through the system of the crashed rider, and this can often mask initial symptoms of a serious injury. What you want to do is you want to ask the rider to stay still, take a few deep breaths, and then calmly assess them for the presence of any serious injuries before you ask them to move or before you move them yourself. By asking a few simple questions like, what's your name? Do you know where you are? Do you know what happened? You can get a quick assessment for whether a patient is confused or whether they've had a severe injury that's affecting their mental status. The presence of any confusion or disorientation is a huge red flag and should be immediately followed by activating EMS. Other concerning findings that you may find when assessing the patient are things like pain in the head or the neck, an inability to move the arms or the legs, any obvious deformity of the arms and legs, difficulty breathing or shortness of breath, any numbness or tingling in the arms and legs, and of course the presence of any obvious bleeding. In the presence of any of these red flags, signs, or symptoms, it's absolutely time to stop the ride and to activate EMS. If after your initial assessment you deem that the crashed rider seems stable, doesn't have any obvious head or neck complaints, and is able to move their extremities, if they're in danger, either on the road or somewhere where they may be hit by traffic, it's then appropriate to help them move to a safer part of the road. In the case where you deem that the crashed rider has a serious injury or one that requires the activation of EMS, your priorities shift into stabilizing the patient and keeping them safe until EMS arrives. The roadside is not the place for heroics like reducing a fracture or popping a joint back into place. Your goal is to keep the patient calm and safe until the appropriate EMS services arrive. If you notice any areas of significant bleeding, direct pressure on the area can help tamponade some of the bleeding and reduce it. Furthermore, you can use an inner tube or a spare jersey as a tourniquet if the bleeding is really severe. In the case of an upper extremity fracture like a clavicle fracture or a distal radius fracture or wrist fracture, sometimes some basic cycling equipment can be used to help stabilize the fracture until EMS arrives. An inner tube can be placed around a downed rider's neck, and with the arm at roughly 90 degrees, you can just wrap the arm and keep it here for some easy stabilization. Another good tip is if you have any spare cycling insoles, oftentimes these are quite rigid, and in the case of a wrist or a hand fracture, they can be used as a very easy way to immobilize the segment. You place the insole here on the what we call the volar or the front surface of the wrist, and then you can wrap it with a jersey, a sock, or an inner tube, and this provides some nice immobilization of the hand and wrist. Another key principle when assessing a downed rider on a crash is you need to be extra vigilant about delayed onset symptoms. What I mean by this is that often once the adrenaline of the crash fades, a patient's symptoms reveal themselves, and you need to be watching out for these. After 5 or 10 minutes, it's not uncommon for a patient's condition to deteriorate quite quickly, and it's very valuable if you're aware of these things so that if they do happen, you can escalate appropriately. If a patient develops any confusion or changes in their mental state or suddenly is unable to bear weight, this is a classic delayed symptom that needs to be looked out for very carefully. I hope this video provided some helpful tips for giving you confidence to act appropriately when a crash does happen. The goal again is to stay calm, assess the patient, and decide when it's necessary to activate EMS. If you found this video helpful, please consider subscribing. I'll be posting more content in the future, all things cycling performance, training, and recovery. See you next time.